Before you sign up for a Medicare Advantage plan, there is one step that will save you money, frustration, and even keep you from losing access to your favorite providers. Many people overlook it, but it plays a big role in choosing the right plan. So today I want to talk to you about why checking your plan's provider network matters and how it can help you avoid unexpected problems later on. Let's start with just the basics. Most Medicare Advantage plans have what is called a provider network. And this is simply a list of doctors, specialists, hospitals, and other vendors or facilities that have contracts within the plan. When a doctor is in the network, the plan has agreed on pricing, which often helps keep your out-of-pocket costs lower. Networks are one of the reasons that Medicare Advantage plans are able to offer such affordable coverage and extra benefits in the first place. Some plans do allow care outside the network, while others focus on just the in-network care. And understanding how your plan's network works ahead of time helps you know what to expect when you use it. So, why does this matter when choosing a Medicare Advantage plan? Well, first, knowing the details of the plan's network will help you understand your coverage and your potential costs. A plan may have a low monthly premium and strong benefits, but your experience is likely going to be best when your regular doctors are part of the plan. Second, different plan types work in different ways, and this is where HMO and PPO networks come in. HMOs are designed around in-network care. They work well for people who are comfortable choosing local providers within the plan's network and coordinating care through a primary care doctor. Many people like HMOs because they tend to have low and predictable costs. In fact, more than half of beneficiaries in Medicare Advantage plans are on HMO plans. PPO plans offer more flexibility. With a PPO, you can usually see providers outside the network without a referral, though staying in the network typically costs you less. However, the provider outside the network must first agree to bill the plan before you can seek healthcare services from that provider. PPO options can be a good fit for people who want more freedom in choosing their providers. However, in 2025, we saw many PPO plans exit the market, and this may be because they are less profitable for the insurance company. So both plan types can be good options. The key is choosing the one that fits how you prefer to receive your care. Third, doctors who accept Medicare do not automatically participate in every Medicare Advantage plan. Each plan has its own contracts, and this can be even within the same insurance company. That is why it is important to confirm your doctors and other providers using the exact plan name. Finally, provider networks can and do change over time. A doctor who is included this year may decide not to be included next year. And that is why we encourage reviewing your coverage regularly. The annual election period in the fall is usually the best time to do this. Medicare Advantage plans also have an open enrollment period from January 1 through March 31 each year for people already in a Medicare Advantage plan. It allows you to make a one-time change during this window if you find that your current plan is not the best fit for your doctors or your healthcare needs. Let's look at how this applies to different situations. If you want to keep seeing your current primary care doctor, checking the network should be one of your first steps. If you see specialists such as a cardiologist or endocrinologist, confirming that they're in the network helps you keep your care coordinated and your costs manageable. If you have ongoing health conditions, having the right providers in network supports consistent care and helps you get the most value from your plan. And if you travel often or you live in more than one state, it is helpful to understand how your plan's network functions when you are away from home. Some plans are really more local, while others offer broader access. And if you prefer a certain hospital or healthcare system, reviewing the network helps ensure that you can use those facilities whenever needed. Checking your provider network is also not complicated. You can use the insurance company's online provider search tool, or you can call your doctor's office to confirm the specific plan they accept. You could also just work with our team here at Boomer Benefits, and we help our clients review provider networks every day so they can feel confident in their choices. When checking with your provider's office, be sure to always use the full plan name. Simply saying you have a plan with a certain insurance company is not enough, since most insurance companies offer different plan options. I go over this and how to do it correctly in my book, 10 Costly Medicare Mistakes You Can't Afford to Make, which you can find on Amazon or Barnes & Noble. In closure, choosing a Medicare Advantage plan is about finding the right balance of cost, coverage, and access to care. When your doctors and hospitals are in your plan's network, these plans can offer strong value and useful benefits. If you would like help reviewing or checking provider networks, our team is always happy to help you, and our service is free. We do all the heavy lifting for your peace of mind. You can find our contact information in the description below or on our website, boomerbenefits.com. And if you want to see more about the pros and cons of Medicare Advantage plans, watch this video next.